Hello, my name is Benjamin,
And I'm Naomi.
and together we are Benomi.
Benomi.
So, I'm an experienced RN. I've been a registered nurse for the last 9 years, and I've worked in a variety of settings, including acute care, hospice, and a little bit of long term care.
And my name's Naomi. I've been an RN for almost 5 years, mostly in the long-term care setting.
And for this post, we're going to talk about Suicide Prevention Month. It is the month of September, and so in the United States, it is Suicide Prevention Month, and more specifically, for the week of September 9th through the 15th, it is Suicide Prevention Week. And so we're going to see how this information about suicide can apply in the nursing world.
Yeah, so we're going to talk about suicide prevention in various healthcare settings. So I'll start us off with suicide prevention in the nursing home long-term care setting. So first of all, if a resident expresses a suicidal ideation, we're going to start 15-minute checks, get a psych consult so they can talk to a psychologist, and also we're going to check to make sure they're not pocketing their meds. And then, of course, if it gets to a really bad point and they actually have the physical ability to commit suicide, then we would send them out to the hospital. And of course, all of this is based on your facility's policy.
Okay, very good. And so speaking of the hospital setting, if it does come to that, I've worked on the floor, various units in the hospital, so not in the emergency room itself. So usually when patients get admitted, we already know if they have suicidal ideation. And so once they're there with us on the unit, you want to make sure that they have one-to-one monitoring. In many facilities, in many places, there are things called telesitters. Some use the AVASIS system. And so suicide patients are not appropriate for this. They need one-on-one monitoring. And so you want to maintain the safety of the room, the patient's safety. So you want to search the room, make sure that there are no sharp objects. You want to make sure that suicide precautions are ordered in Epic or whatever electronic system that your facility may utilize. So this would mean when they get a dietary tray that they use plastic silverware and things like that. And you may even want to consider limiting. I'm not sure, you have to check with your facility, but in the past we've taken away their telephone, their room phone with the long wire and so forth. And so you want to make sure that you don't leave your stethoscope, any pens, or
Your bandage scissors.
yeah, your bandage scissors,
like
and if you have hemostats, stuff like that, anything sharp. And so the MD must decide to discontinue the suicide precautions. This is not a nursing-based judgment, but through good physical assessment and through engaging with your patients, you can, get a clue if they're still having suicidal ideation. And of course, you're going to want to check your facility's, policy. Also, too, there may be a change in their status, which may make them more emotionally desperate, and which may make them suicidal. So if you notice those changes in your patients, definitely engage with them and let the doctors know.
Yeah, it's always better to err on the side of caution. You don't want to just assume, oh, they're just saying it. You always want to take any type of suicidal thoughts very seriously and address them.
Yeah, definitely.
So I'll talk a little bit about the home health area. It's kind of harder because you're not there with the patient. There's not usually medical staff there. I had one experience with this, and it involved calling them multiple times and telling them, that I felt like she was in a psychiatric emergency, because once it reaches the level of having the thought and then having a plan in place, that's what's important. That's what constitutes a psychiatric emergency, is when they have a plan in place. Unfortunately, being home health, the only real options you have is you're going to communicate with your supervisor those things, and then you may have to call 911, or if your nearby hospital has it, they may have a psych emergency service that will go pick them up to receive psychiatric care at the hospital. You want to do a good psychiatric assessment every time you go and visit that patient.
Yeah, and something you're going to see in your own practice is that psychiatric patients are everywhere. Mental illness is flourishing in this country due to a variety of reasons. We'll talk more about that in the upcoming months during National Mental Health Month, and we want to make sure that you guys feel a little bit more confident in your practice.
Yeah, and also we want to mention the national, for US, the suicidal hotline. It's 1-800-273-TALK, and that's where you can have access 24/7 to trained counselors. That's about it for today, and let us know in the comments below what type of videos you'd like to see coming later on.
Yeah, and we love to have you subscribe and continue following with us. So for now, this is Nursing with Benomi, and check with us next week.
Have a great day, and we'll see you next Tuesday.
See you guys.